The effects of childhood trauma are often long-standing and chronic. Adult survivors of complex childhood trauma can struggle with processing what they survived in childhood, which can lead to a host of emotional, psychological, and physical symptoms. Equally common are histories of toxic romantic relationships, poor choices in friends, and patterns of self-sabotage based on shame and guilt for what they survived. 4 common patterns seen in adults with histories of childhood trauma include 1. Misdiagnosis and comorbidity. One of the largest impacts on adult functioning after surviving chronic childhood trauma includes feelings of anxiety and depression. Many with histories of significant attachment and developmental traumas struggle with symptoms associated with dysregulated affect, mood disorders, including bipolar disorder or major depression, generalized anxiety, social anxiety, post-traumatic symptoms, or obsessions and compulsive behaviors. Some may receive an incorrect diagnosis, while others may receive comorbid diagnoses. Yet, symptoms of depression and anxiety also mirror core symptoms found in borderline personality disorder, BPD, in which existing research supports as caused by a combination of biology and environment, including severe and chronic childhood neglect and abuse, Erkoreka et al., 2021, Harnd et al., 2013, and Scott, 2017. However, because of social stigma that often surrounds BPD, many with histories of complex childhood trauma may go without a proper diagnosis or intervention required for healing. Others may receive a prescription for an antidepressant or an anti-anxiety medication, which may numb troublesome symptoms, but cannot provide full support or treatment. 2. Chronic pain. Existing research has found that adults with histories of childhood trauma, specifically physical abuse, are at an increased risk for developing chronic pain, including back and neck pain, headaches and migraines, gastrointestinal and pelvic issues, rheumatoid arthritis, and fibromyalgia. Trauma, especially chronic trauma early in life, may lead to permanent changes in the central nervous system, CNS, which may make a person more vulnerable to developing depression, anxiety, chronic pain, and autoimmune diseases. Similarly, existing research suggests higher correlations between attachment style and development of chronic pain, specifically those with an anxious attachment style as having an increased risk for allostatic load. According to Whittam et al., 2019, anxious attachment style in adults predicted higher levels of allostatic load, which may be a predictor of later development of chronic pain. 3. Pathological love-addicted behavior. If a person has experienced profound attachment trauma, how they approach adult romantic relationships may include a dance of pulling towards or pushing away out of survival mode. When a child's basic needs for safety, consistency, predictability, love, nurturance, and support are not met in childhood or are only met intermittently, these can create maladaptive patterns of behavior that are learned and acted out in romantic relationships in order to get their needs met. While love addiction is not a formal diagnosis in the DSM-VTR, 2022, the symptoms mirror unprocessed attachment trauma, including an intense need to be in a relationship for external validation, a shaky sense of self-identity or mirroring their partner, high levels of control or manipulation, a need to fix or be saved, and patterns that are associated with unmet basic needs, including to feel safe, seen, heard, and unconditionally accepted. 4. Codependency and self-betrayal. Childhood abuse can include invalidation, which is sometimes known as silent abuse, because it can be difficult to spot and identify. Common patterns seen in invalidation include ignoring, dismissing, minimizing, or rejecting a child's feelings, needs, or opinions. Children who experience invalidation can become depressed or believe something is wrong with them. When a child has their reality denied, it often conditions a pattern of trying harder to gain their caregiver's approval or validation, which can breed enmeshment and codependency and self-betrayal for the sake of trying to be loved. Fast forward into their adult lives, and many have histories of choosing partners who silence, shame, belittle, mock, or dismiss their feelings and needs. Instead of leaving an abusive relationship, those who struggle with codependency also believe that if they try harder to meet their partner's needs, their partner would see their value and worth, which often leads to developing a pattern of self-betrayal. Trauma is a deeply distressing experience that can have long-lasting effects on an individual's mental, emotional, and physical well-being. Whether it stems from childhood abuse, combat exposure, or a natural disaster, trauma can leave individuals feeling overwhelmed, trapped, and disconnected from the world around them. Fortunately, advancements in mental health care have led to the development of trauma-focused treatment approaches that offer hope and healing. Understanding trauma and its impact. Traumatic events can cause profound changes in the brain, leading to altered neural functioning and emotional regulation. According to Benjay et al., 2016, an estimated 70% of adults in the United States have experienced at least one traumatic event in their lives. The effects of trauma can manifest in various ways, including post-traumatic stress disorder, PTSD, anxiety, depression, substance abuse, and relationship difficulties. It is crucial to recognize the widespread impact of trauma and the urgent need for effective treatment interventions. The power of trauma-focused treatment. Trauma-focused treatment refers to therapeutic approaches specifically designed to address the consequences of trauma and facilitate recovery. One such evidence-based approach is trauma-focused cognitive behavioral therapy, TFCBT. TFCBT combines cognitive behavioral techniques with trauma-sensitive interventions to help individuals process traumatic experiences, develop coping skills, and build resilience. Research has consistently shown the effectiveness of TFCBT in reducing trauma-related symptoms and improving overall functioning among children, adolescents, and adults. TFCBT typically involves the following components: psychoeducation. Therapists educate individuals about trauma and its effects, helping them understand their reactions and normalize their experiences. Skills building. Coping skills, relaxation techniques, and emotion regulation strategies are taught to help individuals manage distressing emotions and challenging situations. Trauma narrative. Individuals are guided through the process of sharing and processing their traumatic experiences in a safe and supportive environment. Cognitive restructuring. Maladaptive thoughts and beliefs related to the trauma are identified and replaced with more adaptive and realistic thinking patterns. Skills building, coping skills, relaxation techniques, and emotion regulation strategies are taught to help individuals manage distressing emotions and challenging situations. Trauma narrative. Individuals are guided through the process of sharing and processing their traumatic experiences in a safe and supportive environment. Cognitive restructuring. Maladaptive thoughts and beliefs related to the trauma are identified and replaced with more adaptive and realistic thinking patterns. Gradual exposure. Individuals are gently exposed to trauma reminders in a controlled manner to reduce fear and avoidance.